Hello everyone there, my name is Shashwat Patel. I'm working as Assistant Arts in the Department of Anesthesia since 2016 in Germany. I'm here today to share my experience with the approbations exam to acquire medical license for foreign doctors who wish to continue when pursuing their career as a doctor in Germany in the field of medicine. So now I am talking about approbations exams or Kenntnisprüfung. These exams has been divided in 3 stations: Patientengespräch, Dokumentation und Visite. And all the questions during your approbations exams are based on the subjects of internal medicine, surgery, pharmacology, radiology. First part, Patientengespräch or the history taking part, where you meet your patients in patient's room. You have to introduce yourself first before you start asking any questions to your patients, and then you start asking all the relevant questions to write your anamnese, and that we have learned during our medicine school. And at the end of your communication with your patient, you come to a conclusion with a preliminary diagnosis. And before you leave your room, before you going to write your anamnese, you have to explain your patients your preliminary diagnosis, all the medicaments that you want to give that patients, and the relevant investigations, inclusive laboratory or instruments, non-invasive, invasive methods. At the end of your patient's Gespräch, now you come to your conclusion with a preliminary diagnosis. Before you leave your room, before you start writing anything, you have to explain your patients your preliminary diagnosis, what you think, and then all the relevant investigations, inclusive laboratory, non-invasive, invasive method of investigations, and treatments, what you want to prescribe that patient. Explain patient, and then you start writing your anamnese in the second part of our exam, that is documentation. So now we are in the third part of our approbations exam, which is very important. You have to introduce yourselves to the examiner, and you need to justify now your preliminary diagnosis, plan of investigations, and suggest your further line of treatment according to your preliminary diagnosis for that particular patient. At the end of your presentation, you will be asked few relevant questions to that diagnosis. It can possible that doctors or examiners wants to know if you think of any other diagnosis, or if you know some science related to your diagnosis, or if you know non-invasive, invasive methods of investigations. These all questions will be asked in front of your patients according to your diagnosis. Then you get one ECG. You have to explain. Now this ECG is not relevant to your patients. It's just to know if you can read an ECG. X-ray. You have to explain what you see in the X-ray. The diagnosis is not important for your X-ray, but you have to explain whether you see a fracture, where you see a fracture, what you do. If it's a pneumothorax, what you do at the emergency level, or the first reaction. So the whole base of your approbations exams is that how you present yourself and how you explain. Fachlich and sprachlich. The language is very, very important. You will be judged not only fachlich but also sprachlich. You should be in the situation to explain all the questions which will be asked, because it's not that you will be asked only what you have as a preliminary diagnosis. You can be asked an orthopedic or a trauma or an emergency medicine. you have a patient, for example, you have a patient with the high blood pressure or a hypertensive crisis. What is your first step of management in the emergency department? What can be the further diagnosis? What can be the co-sequence? Again, at the end of the exam, that just present yourself, just be calm, don't hesitate. If you cannot answer something in German, you can also try to explain him in English, because it's not possible that everything which is asked must be answered. You can try that, okay, I know the answer, but I am just not in that situation, or I am just a bit stressed and I am not able to find those words. You can do everything, but just don't say that you don't know anything, because the moment you answer "Ich weiß nicht," then it's very difficult for them to judge you as a doctor. Because in the emergency department, when you start work in the emergency department, it's the you and a patient where you have to explain yourself, where you have to explain your line of treatment, investigations to the patient who doesn't understand English. The examiners are from 3 different departments. Can be surgery, medicine, orthopedy, radiology, hematology. And the examiner also wants to know if you are capable to judge their own line, own department, own patient. So now I just want to tell you at the end of my presentation that the Approbations exam, Kenntnisprüfung, and the Fachsprachprüfung, or the patient's communications exam, which you have to also clear before you get your medical license, are based on the same stations which I have already explained to you. And the only difference is during your Fachsprachprüfung is based on language. You should be in the situation to explain in German, to understand in German. It can possible that it will not be asked more towards your medical knowledge. And then for the approbation exam is more to your knowledge and language, of course, because at the end of the day you are going to meet the patients who are non-English speaking Germans. For any further questions and clarifications regarding approbations exam, you can get in touch with us. I hope my information helps you to pursue your career in Germany, and good luck to you guys. Thank you.